Dr. Manisha Gogri, a lactation consultant and a medical doctor, and I'm here celebrating the World Breastfeeding Week with BabyChakra. Do you know that mothers who are adopting babies or mothers who are having babies via surrogacy can also breastfeed? And there are some mothers who have unfortunately stopped breastfeeding due to medical reasons or due to lack of support. Even if it has been several weeks to months, these mothers can start breastfeeding once again. This is possible via the process of relactation and induced lactation. So let me tell you about relactation. There are so many mothers who did not get the right kind of guidance and help and therefore had to stop breastfeeding their babies, but now want to start once again. So via the process of relactation, this is possible. There are two main aspects. One is to get back the milk supply and the other is to get the baby back to breast. Getting back the milk supply is possible by using certain medicines, herbs, and more importantly, lots of skin to skin contact with the baby. The more difficult part is getting the baby back to breast. The babies are often used to bottles, nipple shields and pacifiers. We need to get rid of those and start feeding the baby using a cup or something like a paladai and get rid of the bottle. This helps us to change the baby's sucking pattern. Also, there is something called at-breast supplementation. There are lactation aids such as these which could be the better alternatives to bottles because these help us to feed the baby directly at the breast. An important part of increasing the milk supply is also to start expressing milk. So the expression can be done using a hand or better a double-sided hospital grade pump which helps us to bring in the supply faster. Using both these techniques, getting the baby to breast and getting in the milk supply, gradually the need for supplementation increases and most of these mothers are able to go on to almost exclusive breastfeeding. Let us now discuss induced lactation. These are mothers who have never breastfed, so their body has never prepared for breastfeeding. We start by creating a pregnancy-like state, typically using hormones, herbs, medicines and pumping. We need a time of at least 6 months to complete the entire process. But even if that is not available, we can work with shorter protocols. Many of the mothers are not able to reach full supply, but that is not exactly the aim. Breastfeeding is more about bonding with your baby. It's not only about breast milk, and that is something which is so precious and valuable. That can definitely be achieved through this process. So once the medicines are started, it causes breast development and some milk starts getting produced. About 6 to 8 weeks before the baby is due to arrive, we stop the hormones and continue with expressing milk using a double hospital grade pump which gives us the best results. Once the baby arrives, the baby immediately initiates breastfeeding just like any other normal child. So in case of adopted babies who are older and who have initially been bottle fed, just like in the process of relactation, we can start with skin to skin and at breast supplementation. The more the baby suckles at the breast, more milk the mother produces, and that is how her supply is going to increase. Mothers are often happy even if they don't reach full supply because all the feeding is happening at the breast without a bottle and using supplementers. So through the process of induced lactation, mothers who have not given birth can also thus breastfeed their baby. Thank you so much for watching. If you like this video, please click on the thumbs up, and for further such interesting videos, subscribe to BabyChakra. Thank you.